So I'd like to introduce you to the Association of Cannabis Specialists, ACS. So for those of you who don't know about cannabis, now's your time to ask those questions. So we have with us today uh, Dr. Tischler and a policy advisor, as well as I think the president is here as well. So we're so excited to welcome these two in their new leadership capacity to lead the country. And we would love to learn about all these developments. So over to you. Would you all like to share your screen, or would you just like to talk? Let us know.
Okay.
Yep. So, I mean, just as a sidebar, there's Dr. Tischler and Tami Wahl. Are you seeing separately? Very good. Thank you for joining us today. I appreciate your added advice and further dimensions so that we come to understand this latest and newest crave regarding cannabis and the distinctions between, what's it, CBD it's called, and those things. Thank you, Dr. Tischler.
It's my
Please share.
pleasure. Thank you for having me on today. It's a pleasure to be here. Tami Wahl, unfortunately, was unable to make it this morning. She had a bit of a family emergency, but I think I can probably do us justice here. Thank you again for having us on. We are an international not-for-profit called the Association of Cannabinoid Specialists. We actually used to be called the Association of Cannabis Specialists, but we recently changed the name just slightly to cannabinoids to focus us a little bit more on the various medications that can be derived from the cannabis plant, in addition to simply the uses of the botanical material itself. As research is progressing, we're learning a whole lot about what these chemicals can do for us, and it's a very exciting field at this point. I understand that you guys are in North Carolina, is that correct?
That's right. Yep. That's right. That's right.
So you guys are a little bit late to this party, so to speak, which is actually not necessarily a bad thing. I think if we look across the states, many of the states that have come to this a little bit later have had the benefit of watching the other states do it first, and actually have been able to come to a good place, or maybe a better place, with their state's regulation. One of the things I think is really important for us to understand is that, in addition to all of the states making cannabis legal as a medication, which is something that I think that needs to happen and needs to continue to happen, we really need to get the federal government to do this as well. The federal government, as you're aware, is responsible for harmonizing between the various states. They're involved in things like interstate travel, which is true for patients who need to be able to, say, go to Florida for the winter, although I guess that's less of a problem in North Carolina compared to Boston, where I am. And also for interstate commerce, which means that, cannabis might be grown very well in the fields of North Carolina, but want to be sold in New Jersey. And being able to then put it on a truck and send it from one state to the other is presently not legal, and needs to change so that we can develop a better economy around this.
I have two good friends of mine, and they're farmers. They farm substantial acreage, and they've introduced, because of the state regulations, they've been allowed to certain tracts of land, because it's pretty regulated. And it's pretty, there are government restrictions on what you need to follow and what's allowable. And so, but they've actually increased their profit margins by 35% by including CBD growth in their farm capacities. It's an amazing story. While we are late to the party, and because of restrictions and regulations, you're right. There's some things that we can add value with understanding what it means and where we could go with that.
Absolutely. And it's also interesting that you bring up the farming of hemp. Many of your viewers may not be familiar with the difference between cannabis or marijuana and hemp. And it really is, unfortunately, a somewhat silly legal distinction that hinges around one of the chemicals that it produces, that being THC. People are very quick to say, oh, THC, that's the part that gets you high, which is true. But at least from my perspective, that's largely a side effect of a medicine that is remarkably useful for a range of things, from pain management to sleep issues to anxiety and depression, et cetera. So I think that sort of we still have this division that demonizes one of the chemicals that this plant produces, that we have 60, 70 years worth of good scientific data regarding its effectiveness for a range of illnesses. Hemp, on the other hand, is defined as plants from this cannabis species. I mean, they're all the same plant, but they can be bred so that they don't produce much in the way of THC, and then that becomes available and legal to farm. And hemp is a wonderful product because it can be used for making things like paper and textiles, and even as an ingredient in more biosustainable concrete. And so hemp is a wonderful product. Currently, it's being used to derive other cannabinoids like CBD that you've mentioned, where unfortunately sales vastly exceed our scientific understanding. And so we're seeing some problems develop there between an industry that wants to sell lots of products and the public health and safety, where a lot of these products are somewhere between useless and possibly even harmful. And not enough regulation around the development of science there. For example, CBD people think of as somewhat harmless, but in fact, what we know at this point is that CBD doesn't seem necessarily to be all that useful in human beings, adult human beings, and at higher doses can become a problem interacting with people's other medications, and may even cause some direct liver toxicity. So there's a little bit of science left to be done on the safety side, and a whole lot of science left to be done on the side of whether it's actually any good for anything. So I think, you know, we're seeing some conflict between sort of commercialization and medicine / science.
Yeah,
actually, at noon today, we have a chef that's going to show us some cooking recipes with CBD. I was trying to get you two to be on the Zoom together, but it wasn't. It was a schedule thing. But if you are available at noon, please join us. Yes, Elton.
Now, there's been some speculation. I have a friend of mine who lives on the West Coast, and in California, of course, they have medical prescriptions to help with the side effects of chemotherapy, and also now I think he takes it because of high blood pressure or something like that, and he has a medical prescription for it. And I mean, all across America, each state has to determine the regulatory conditions, what it can be used for medically, and how the sufficient quantity relative to that. Now, as a matter of fact, I think there's a national campaign now that has set to decriminalize the use of marijuana or that kind of thing. Now, this, we want this description and these discussions are in a way to help open up people's thoughts and feelings about treatment, medical use, the capacity for understanding how it works, and what the benefits. Because as I understand it, doctors and medical treatment or specialists have determined that whatever can get your patient to the other side of the ailment, the illness, or whatever that way is suitable and is plant-based. So that's an interesting prescription.
Yes, so tell us about what's going on in Washington and your role with policy there, because I know this is going to be a lot of work to get this into policy, and as Elton said, to regulate it, and it's a lot of work. So your role is pretty defined, isn't it? You probably are very busy too. Yeah.
Yeah, unfortunately, I am insanely busy. Let me roll back a second and say, California is an interesting idea. They basically invented the current model of medical cannabis, and it's not a very good model. And essentially, there are no prescriptions. Rather, there is just sort of this go and do it yourself mentality that I think has left a lot of people very unclear as to what they should be doing, and also leaves them open to the risks of overuse and misuse. And ultimately, we don't sort of suggest to people that they DIY their healthcare, and I don't see why cannabis medicine should be viewed any differently than other medications that we have. So it's my strong contention that the model where, you know, at best there's a doctor saying yes or no is not a viable option, and that we really need physicians like myself who see patients and specialize in this and follow their patients carefully and are very specific in guiding their patients so that patients get their best outcomes rapidly without excessive cost and while avoiding both side effects and long-term risks. And there are, in fact, side effects and long-term risks from cannabis use. There is a very strong kind of push at the grassroots level to say, oh, it's just marijuana, it doesn't hurt anybody, you know, it's just fine, go do whatever you want. That mentality is unfortunately good for the people who want to sell cannabis in its various forms, but it is not a good approach to medical care for people who are ill. Which leads me to your question about national policy. Right now, as you may be aware, Senator Schumer, Senator Booker, and Senator Wyden have introduced a new bill into the Senate that aims to legalize cannabis. And unfortunately, this bill, which is, you know, early days, but really doesn't focus on medicine and patient care very much at all. It's focused largely on making it legal, which is good for industry, and focusing on taxation and the use of that tax money to go into a trust fund to help ameliorate some of the damage done to communities of color by the war on drugs. And, you know, I would say it's very important for us to legalize cannabis for recreational use. It's nobody should be going to jail for this sort of thing. I think that the efforts being made to help undo some of the harms to communities of color is a wonderful thing. But then they kind of drop the ball on medical care and patient care. And it's very easy to get focused on the social justice issues of the moment without remembering that healthcare is a social justice issue, and that we are looking at something like 180 million Americans alone who will benefit from medical use of cannabis, as compared to somewhere around 20 to 30 million Americans who typically use cannabis in a more recreational fashion. So our goal really is to remind the federal government that we need to provide appropriate care for patients across the country, and not have that sort of get lost in the enthusiasm over the more recreational use. One of the things I think is really important is that we need to get to the place where cannabis can be prescribed by physicians and other clinicians, so that we know that patients are getting the kind of medical care and guidance that they need, and also know that if one is providing that kind of medical care and guidance, that the patient will end up with the correct medicine at the end of the sales process, and not have the sales portal, the dispensary, changing the program or selling products that are not appropriate for that patient's particular needs.
Wow, that's a lot of work. Now,
if I hear correctly, you're saying there should be. Okay, go ahead. I mean, I'm looking at policy. You're saying that if more attention and focus was placed on policy for medical treatment, there may be greater benefits for the use of cannabis. And so it sounds like cannabis is almost being cannibalized for the right of use to some extent.
Yeah, I mean, you know, when we think about it, there aren't too many, I can't come up with any good examples of substances that are both medically useful and recreationally used, right? I mean, so there are certainly people out there that are using opioids for recreational purposes, but we don't really think of that as a legitimate or a good idea. Certainly alcohol gets brought up, but alcohol really doesn't have any medical benefit. So there's really not a lot of role model for having a substance that we want to control tightly for its medical use and also have available somewhat more loosely for recreational use, and have each group of consumers, for lack of a better word, kind of go in the right direction. So we want, people who are, having some friends over on Saturday night and they're cooking a nice meal and they might want to have some cannabis to go with the Cabernet Sauvignon that they're going to serve. I think that that's fine. But then that same sales encounter should not be addressing things like, what do you do for somebody's back pain? The person with back pain needs to be redirected back into a clinical setting so that somebody like me can make sure that they don't have undiagnosed prostate cancer, or that the medication isn't going to interact with something else that they're taking, and that they get the appropriate product in the appropriate dose, and that I follow up with them to make sure it's working and to adjust it and to help them really navigate the system so that they end up with the right medicine and the best outcome. And that's a tough regulatory scheme because we don't have those role models.
Thank you so much. I saw Patrick getting on, but I guess he's still getting on. But thank you very much. We will continue this conversation. So if you have a comment and you're watching this broadcast on Facebook or YouTube or any of the channels, write us a comment and we'll send the questions back to Jordan Tisler. And anyone who has a question, please put it in the chat, and we'll send you an email with the questions and you can answer them. And we will continue this dialogue, and I would like to bring you back and get into more detail about what's going on, and maybe we can do a column with your organization and keep people up to speed. This is about medical treatment, and that's very important. So I have to say thank you, but you can stay on. We've got a chef coming on. He's a chocolatier. And Patrick, are you on? Or did we lose him? He's coming on. Okay. All right, he's coming on.
I too would like to thank Jordan for his comments here. They've been vital to understanding, because the world is changing now, and alternatives to health treatment. I think we have focused on alternative supplemental health. As a matter of fact, one of our upcoming speakers is a physician who stresses, the importance of getting a second and third perception of a medical issue before just automatically moving to surgery, and whatever alternatives that exist that can add value to your overall health. Alternatively, we must investigate, and we have to truly pursue medical treatments that add value, they protect your health, and regulate body systems. And this is almost the discussion of CBD, hemp, and services like that. It's almost like the dog coming back to bite us, your own dog. But the point being that if hemp and CBD and those kind of things can add value to your health in a profound and significant way, we have to go at that in a way that gives us great benefit, and ignore the earlier diagnosis of a particular perception, but also giving what Dr. Jordan has said, vital understanding and consideration. And we encourage you to continue to do your work and be in touch with us. And we'd like to have you back on to talk more fluidly about some of the alternative treatments and some of the procedures that might be a better way to go. I don't think there's any kind of procedure format that each state has authorized, but I'd like to find out more about that, and that probably involves with the work that you do. I'm sure it's okay.
Yeah. My pleasure. All right.
Thank you, really, because you must be so busy. Just one quick question: who's regulating this medical portion? Is it FDA? Is it going through the regular channels, or who's doing the regulation?
That's a great question, and there isn't a simple answer, which is to say that right now there isn't anybody, but the bills that are being considered, or particularly the Schumer bill, would hand the majority of regulation back to the FDA. And that's a good thing, I think, because they're a group of mostly scientists and regulators whose job it is to protect the public. So, but on the other hand, historically, they're not been terribly fond of cannabis. And so I think that if the regulatory authority is handed to them appropriately, they're going to have to get up to speed pretty quickly. And I'm hopeful that my organization, the Association of Cannabinoid Specialists, can be there to help them understand, what is accurate and what is not accurate and what is yet to be determined.
I know we have to break from here, but I have one final question and we'll wrap. But who is the leading industry, state, or international authority in this area, if there is one? California.
Well, I think that every state has done it a little bit differently, and true to the 10th Amendment, we really had the incubator of states. And there are things that are done well in certain states and not well in those same states, and then there are other things that are really well done elsewhere. Florida has an interesting regulation or law that requires a prescription, so that's a really positive thing. Most states have lists of conditions, which is a very bad idea because they're made by a political process, not a scientific one. And Massachusetts sidestepped that by listing a few conditions, but then leaving the determination of appropriateness up to the clinician. And so that's a good model for that aspect. I think what we really need is a federal law / regulation that really takes the best of what we've seen come up across the various states and unifies that and harmonizes that into a law of the land.
Yes.
The interesting story. One last story. George Washington was a cannabis farmer, that's been said, and he used cannabis to help treat his swollen gums because he had wooden teeth, and they would swell, and just to make it easier for him to get by, he used cannabis that way. But that's it's just an interesting story.
There are many
on that note, I have to say thank you so much for this very interesting conversation. We'll keep on dialoguing with it, keep watching, and write us a comment about it, and let's get the story out there so that you can give Jordan and his organization the support that he needs to get all these policies into place. You have a big job, and we would whatever help we can to get your message out. Please do reach out to us. Thank you so much.
Thank you.
Now we have a fantastic panel that's coming up next.